dressing is a protective material applied to the wound. Its main purpose is to provide environment for wound healing. It is also important in order to maintain moist environment, protect against contamination, control bleeding, and protect from injury. According to Swartz, 11th edition, the desired characteristic of wound dressing are as follows. It can promote wound healing, maintain moist environment, it is comfortable, can control pain and odor, it is non-allergenic and non-irritating, it is permeable to gas, safe, non-traumatic on removal, cost-effective, and convenient to use. Wound dressing can be a primary or secondary dressing. What's the difference? The primary dressing must be in direct contact with the wound and should completely cover the wound. A secondary dressing is used to cover or hold the primary dressing in place. A bandage is a strip of material such as gauze. It can be used as a secondary dressing to hold the primary dressing in place. Bandages also protects immobilized and compressed or support a wound or injured body part. Here is a summary of the differences between the primary and secondary dressing. Primary dressing is placed directly on top of the wound. They are made to be highly absorbent to absorb exudate or discharges. They are kept clean and are used with an antimicrobial liquid to function better. The secondary dressing, on the other hand, support the primary dressing and keep it securely in place. They are made to be sturdy, strong, with high adhesiveness to hold the primary dressing in place. They protect the wound site and provide environment for optimum healing. There are several types of wound dressing. An absorbent dressing helps control exudate without soaking through dressing, which can increase infection potential. A non-adherent dressing are impregnated with paraffin, petroleum jelly, or water-soluble jelly for use as non-adherent coverage. A secondary dressing must be placed on top to seal the edges and prevent desiccation and infection. Occlusive and semi-occlusive dressings provide a good environment for clean, minimally exudative wounds. These film dressings are waterproof and impervious to microbes, but permeable to water vapor and oxygen. Hydrophilic dressing aids in absorption, whereas hydrophobic dressing is waterproof and prevents absorption. Hydrocolloid and hydrogel dressings attempt to combine the benefits of occlusion and absorbency. Hydrocolloid and hydrogel forms complex structure with water, and fluid absorption occurs with particle swelling, which aids in atraumatic removal of the dressing. Alginates are derived from brown algae and contain long chains of polysaccharides containing maronic and glucuronic acid. Processed as the calcium form, alginates turn into soluble sodium alginate through an ion exchange in the presence of wound exudates. Alginates are being used when there is skin loss in open surgical wounds with medium exudation and on full thickness chronic wounds. Medicated dressings have been used as a drug delivery system. Agents delivered in the dressings include benzoyl peroxide, zinc oxide, neomycin, and bacitracin zinc. Introduce yourself to the patient and build rapport, and secure consent to the procedure by explaining the purpose, the benefits of the procedure. Here are the materials needed. Make sure that they can be easily reached during the procedure. Remove jewelries such as rings or bracelet or watches. Perform hand hygiene. Put on clean gloves to remove the old dressing. Remove old dressing gently. You may use NSS to loosen the dressing as well as the tape. Discard properly. Assess the wound. Note the color, the discharges, or the odor if present. Note for any bleeding, swelling of skin around the wound, separation of the wound edges, or any maceration. Remove the old clean gloves and put on new sterile gloves. Observe proper technique in putting on your sterile gloves. Use a sterile gauze soaked in normal saline solution or in a cleansing solution to clean the wound. Be gentle in cleaning the wound. The suture line should be the least contaminated area. Clean it first, then going outside. This is in contrast in cleaning a clean, dirty, or contaminated wound wherein you will start outside the wound, going inside. Clean the wound with an antiseptic solution or medications as ordered by your physician. However, antiseptic solutions such as hydrogen peroxide is contraindicated in open wound wherein it can cause irritation or tissue damage. Place a clean and sterile gauze on the wound. Make sure that it will cover the entire wound. Secure it with a non-hypoallergenic tape or apply a secondary bandage or dressing to secure the primary in place. You may fold one edge of the plaster for easy removal. After cleaning the wound and changing the dressing, you may now discard the used materials. Used materials are considered infectious, so discard it in the yellow container. Remove your gloves, make sure not to touch your skin, and discard it properly in the yellow container. perform hand hygiene after the procedure. Then document the patient's chart.